Welcome to Healthy Minds. I'm Dr. Jeff Borenstein. Everyone is touched by psychiatric conditions, either themselves or a loved one. Do not suffer in silence. With help, there is hope. Today on Healthy Minds.
And often because of the stigma, which we all know about, associated with psychiatric issues, people don't ask for help. If you begin to see signs of an illness, it's so critical, because if you wait, often people, they lose their social relationships, they may drop out of school, individuals may not get the help they need.
That's today on Healthy Minds. Healthy Minds is brought to you in part by the American Psychiatric Association Foundation, the Graham Beck Foundation, and the New York State Office of Mental Health. Welcome to Healthy Minds. I'm Dr. Jeff Borenstein. What steps can parents take to prevent mental illness in their children? And if an illness does occur, what early interventions can bring about the best results? Today I speak with Dr. Ann Sullivan, Commissioner of the New York State Office of Mental Health and a leading expert in children's mental health. Ann, welcome. Thank you for joining us. I want to talk with you about the issue of prevention when it comes to psychiatric conditions. In the past, we were only responsive when something arose, but now as a field, we're really looking to see what we could do to prevent an illness.
Now we know that we can intervene early and prevent mental illness. And the earlier, the better. So we know that interventions with families, with children in the ages of 0 to 5 can have a real impact on preventing mental illness, preventing substance use, preventing sometimes even physical illnesses if you work with families early on. So prevention in those early years, we now know, is so critical. So the important thing here is to begin to have available for families an understanding of what are the issues, what are the signs and symptoms of problems, but also if families are experiencing stress, if families are experiencing violence, sometimes within the family, sometimes in the community, which the family has no control over. Issues like extreme poverty, issues like unemployment, issues like loss of a spouse, death in a family, depression of a parent, alcohol use of a parent. All these things have a tremendous impact on children 0 to 5, often before anybody is even thinking about having an impact on the mental health of their child. That impact, if we work with the family, can be prevented. And we know now that those kinds of evidence-based, we call them special tools, evidence-based practices that we can work with families, we can prevent illness that could appear 10, 15 years later.
So when the child is young, even before any obvious symptom can occur, if they're in a stressful environment due to aspects in their environment, taking steps to alleviate those stresses will have a positive impact down the road for that child.
And we know that now clearly from a number of studies that have been long-term studies of families and children. And also, we also know that intervention can prevent it. And we know that similarly from long-term studies. The issue now is to get it out there so that we begin to work on these issues early. And one of the key places you can do that is in the pediatrician's office, where families are often comfortable coming forward if they are having stressful problems at home, or if they're worried about issues with their children, or if they're depressed or upset. The pediatrician's office or your primary care doc, your doc that you see. And if you bring these things up there, we know now that we can have interventions that can prevent mental illness. You know, we know more and more about how important really early prevention is in helping families and our youth avoid having serious mental illness. So we've learned over the years that those first 5 years are critical, and that families that are under a lot of stress, perhaps, sometimes they're dealing with difficult issues like alcoholism, domestic violence. We know that families that are facing these things, that if they're not helped soon and early that the long-term effects for their children are very serious. They have depression, they can have substance abuse problems, and they can often have medical problems, much higher percentage than the general population, heart disease, pulmonary disease, etc.
So intervening and helping the parents who may be faced with those problems not only helps the parents, it also has an impact on their children's future well-being.
Absolutely, and to not be afraid to come forward and get the help you need. So for example, we know very clearly that moms who are depressed, moms who have postpartum depression or come with depression, that their children have a much, much higher incidence of depression when they grow up. But that can be reduced if the moms are treated for depression. So it's so important that families, if they're dealing with stressful issues, often these are issues beyond their control. You know, it could be a loss of a job or a loss of a family member. If they're under stress for this, if they're feeling depressed, if they are beginning to think or beginning to maybe use too much alcohol to deal with these issues, then you've got to get help early because it can affect your children. It can be a very serious problem.
So just as if a family has a risk of heart disease, you may want to do things for the children to reduce their ultimate risk of heart disease, whether it be diet, exercise, etc. You want to take those steps for children when it comes to psychiatric conditions.
Yes, and often because of the stigma, which we all know about, associated with psychiatric issues, people don't ask for help in those areas. And that's why it's so important. One of the big areas where you can have an impact is in that pediatrician's office, where moms with young children, 0 to 5, sometimes moms don't even take care of themselves, but they take care of their kids. They bring them to the pediatrician. And the pediatrician's office can be a nice confidential place, a place where you can mention these problems, bring them up to your pediatrician, and the pediatrician can be helpful in getting you the help you need. Sometimes, not as much as we would like to see it, but across the country, pediatricians' offices have now had specialists in their office. They're called child specialists who work with them, who do things like screening families for depression, screening individuals, and then also are there to work with families if they need the help. And we're actually, in New York, we've started that in 20 practices across the state, and we really want to increase it because a pediatrician's office is a very safe place, I think, for parents to say if they're having problems and to say that the family might be in crisis. And if you can do that, if you can bring it up and get the help you need, you can have very significant impacts to prevent mental illness that develops later.
So a key is for the parent, often it's the mother who's bringing the child to the pediatrician, to really be open about what's going on in their life, if there's a stress in their life, because it does affect the child, even if it's not obvious up front that it is, that the mother or father say, these are stresses going on. I want you to know about it. And then the pediatrician can be of assistance in guiding that family.
And similarly, if they see signs that they're concerned about in their children, maybe the child is having behavior problems in school or has started to drift off in their studies, isn't doing as well, or is depressed, to bring that up either to their pediatrician as well. You know, we know that many mental illnesses start to have signs before the age of 12 to 14. But often no one does anything about it for 4 to 5 years, 6 years, until the symptoms, until the problems have gotten worse. So it's very important that if you see those things early, again, to bring it to the attention of the pediatrician. And families are so critical in helping, if the youth has a problem, getting through that problem. For example, we know that individuals who have their first psychotic episode in their teens, that if you work very closely with families and with the youth, and in some special programs that are now again across the country called Early Psychosis Intervention. In New York, it's called On Track New York. But a team that works with the family and the individual who's had that first psychotic episode, those kids stay in school, get jobs, have good social relationships, and are able to have full and complete lives. So that kind of intervention early, if you begin to see signs of an illness, is so critical. Because if you wait, often people they lose their social relationships, they may drop out of school, individuals may not get the help they need. So we know that sometimes it waits way too long, sometimes a decade before people get the help they need. So again, parents bringing forward the issues.
Right, so parents know their kid, and if they see a change that they're concerned about, the worst case scenario is it's nothing. but at least they're bringing it up. But if it is something, then steps could be taken to have an early intervention for the child to help that child.
Absolutely, absolutely. And similarly, schools, you know, a lot of work is being done with teachers to also notice problems that might be occurring and to talk with families, and for families to be open to that. If a school teacher or if someone says, you know, I think maybe your son or your daughter is having difficulty adjusting here or there, to be open to discussing that and thinking about whether or not perhaps they need to do something to help that child do better in school. There's a lot of effort now to train individuals in schools to also be aware of stresses, some signs that maybe mean that a child is having difficulties or a family's having difficulties. And often people are ashamed. They feel, well, I don't want the school, you know, if they say this, I just want to kind of hide it. But I think if you begin to hear about it, it's again important to seek help.
Think of the school as a part of the team that's helping you raise your child in a healthy way.
Exactly.
What are the types of symptoms that parents should be thinking of? Because sometimes it's hard to tell, is this normal growth of the child versus something that may be a concern? What types of things would you be concerned about as a mother?
One thing is changes that seem unusual, you should pay attention to. So if your child seems a little more withdrawn, doesn't seem to be with friends as much, seems a bit more moody or preoccupied, or if his or her behavior has suddenly gotten more agitated or irritable. If this lasts for a period of time, like not a day, but if it lasts for weeks or it seems like the child is not doing so well in school, they were doing okay before, but then there's been a change, then you should definitely look for someone to talk to your pediatrician and say, look, do you think that there might be an issue here? And he may refer you to see a psychologist, a social worker, a psychiatrist, and not to be afraid of going and discussing that. The other thing is if you're having a lot of trouble at home yourself as a mom, you should discuss that either with your primary care doctor or with your pediatrician as well. Because your stress, your tension has an impact on your kids. And if you can deal with that, that will also help your kids. So again, if you're feeling depressed, if you're feeling worried a lot, anxious, if you feel like you're not coping so well, then get some help to do that, because you don't want that to impact your children. Just like smoking can impact your child because the smoke is in the air. It's a similar thing. If you're tense, if you're upset, if you're having emotional problems, that can have an impact on your kids.
So treating yourself as a mother not only helps you, but just as importantly, helps your child down the road.
Absolutely, absolutely. So it's really very important that, and we're doing a lot of work educating pediatricians too, and other physicians to be aware of how to get help for individuals, and so that's a critical piece. That's a critical piece, and we're doing a lot of that in New York and across the country.
If a pediatrician recommends that the child see a psychiatrist or a psychologist for further assessment, what types of things will they do in terms of that assessment? How do they determine that maybe there's something that needs treatment?
Well, I think you will do a lot of talking to a psychiatrist. I mean, they're going to ask you how you're feeling. They're going to ask you about the behavior of your child. What's got you worried? What are you concerned about? And the important thing is to be open. There's nothing too small to talk about, and there's nothing to be ashamed of. And often you go to see someone and they may say everything's okay. Or they may say we need to intervene in some way to help you and your child. Sometimes it's talking therapy. Sometimes it could be medication. Sometimes it's family work. Sometimes the whole family has to come together as a team to help the child do better. So I think it could be a variety of things, but the main thing is to just be open and talk about it and see if it can be helpful for you and for your family.
And we know that there's clear evidence that these types of interventions are helpful for people, whether it be talk therapy or medication or family therapy, really has an impact and can make a big difference in the life of the child.
Absolutely, and when they've done lots of studies on this, and they've followed up families and children, 5, 10, 15 years later, and there's a marked difference from individuals who received help for these kinds of things and those who didn't, in terms of their success in school, success in employment, and success in their future lives. So we know that the intervention works. It's kind of getting enough of it out there and having people ask for it too. Because often we still have all that stigma that prevents people from saying, I think maybe I'd like to look at this. If your child falls and their arm hurts a lot, you're going to bring them to the pediatrician. You're going to say, is it broken? Right. You need an x-ray. What should I do? It's the same thing. And I think, pediatricians, believe me, they get calls about everything. The fever's a little too high, this, but they often don't get calls about behavior problems. And I think that that's something that we should kind of help people feel more comfortable doing.
So the types of diagnoses that a child, an adolescent can have can include anxiety, can include depression, can include post-traumatic stress if they've experienced trauma, and can include psychosis. I want to ask you a little bit about the interventions, the early interventions for psychosis that can help get the person on track, to use the terminology that New York has, which is such an appropriate terminology for this. What do they do to get that child on track?
The first experience of a psychotic episode can be very scary. It can be very frightening for the individual. It's very frightening for the family because they often don't understand it. So the first piece of working with the family and the individual who's having that first episode, and that's so critical that the family has to be a part of it. That's what we've learned. They have to be there. Is first of all to understand what's happening. So there is some education that happens. But the second piece is then to have a real dialogue with the family and the individual about how they want to approach this illness. If you, at the age of 13, 14, are diagnosed with diabetes, you go talk to your doctor and you talk about, how do I approach it? Maybe what are the meds I need? Maybe what are the dietary changes I need to have? What are the behavioral changes I need to do? And you make choices with your doctor about how to approach it. It's the same thing with first episode psychosis. You need to have that dialogue, decide where the medicines are right, what other kinds of help someone might need to be able to finish high school. So they get the tutoring, the assistance to finish high school, maybe to keep their job, learning certain social skills again if some of that has been disrupted. But all those things have to be done together with the individual and the family in a kind of partnership, so that what that individual wants is really the priority. And then the treatment team works to get their priorities. And 9 times out of 10, the priorities, I want to finish school, I want to get a job, I want to be able to have a family in the future. Can I do that with this illness? And the reality is, yes, you can. You can do it, but often you need some help to, as you stay on track to be able to achieve those goals.
So with appropriate support, professional help, support from the family, teachers, children are able to move forward with their life, even with a first episode of psychosis.
Absolutely, absolutely. And I think we've learned that the important part is to have that intervention early. If you have multiple psychotic episodes and you really don't get that help you need until maybe 3, 4, sometimes 5, 6 years later, then your school has been disrupted. Often your chances of getting employment become less. Your social connections maybe have been disrupted.
There's a greater risk of substance misuse.
Absolutely. Doing other things to control the psychosis that aren't helpful, like alcohol, drugs, etc. So we know that those are the outcomes if you don't intervene. But when you intervene right away with a really team approach, you can have wonderful results, actually. And the particular program, 80% of the individuals stay in school, graduate, or stay in the job that they had. So that's great results. Without that, you go below 20, 30% of people who continue in their lives in the same way.
So this is a very important message of hope and realistic hope, not false hope, realistic hope for families, for the children affected by a first episode psychosis, that really with embracing the help that's available, they can go on and do well moving forward with their life.
Yeah, and that's such an important message because people are frightened. It seems psychotic episodes are very scary, and so people want to feel they'll just go away, or maybe it'll never happen again. But when you see the doctor, it is a diagnosis of an illness such as schizophrenia, then we know that this kind of help can enable youth to grow and have complete and full lives. And without it, often they don't. So we really need to get the message out of how important this kind of help it really is.
I want to talk about the important issue of suicide prevention in our youth. Suicide is one of the largest causes of death, tragically, in our youth. And I want to talk to you about the types of things that parents should be looking for in terms of potentially having a child at risk and what they should do.
Yeah, I think, we haven't had as a successful decrease in suicide across the country. It's kind of it's plateaued. It's interesting. So we know that this is such a serious issue, and the only way I think that you can begin to tackle it is to have families aware, schools aware, communities aware of the risks that youth can have of thinking about suicide. We know that 14% of youth in New York City high schools have seriously contemplated suicide, not just had an occasional thought, but seriously contemplated. So it's a terribly, terribly serious issue. There's some work which has been done which has been very successful. Some of it involves educating parents, as you say, what do you look for? Well, again, you look, especially in high school students, you look for changes in their behavior, things where kids aren't seeing their friends as much anymore. Grades are slipping. They seem kind of moody, distracted. Maybe they've started to use alcohol a bit too much, or maybe they've experimented with drugs. Maybe they're not sleeping well. Maybe they are getting angry and irritable and impulsive kind of behavior. If you begin to see those things, I think you've got to get help, because kids will rarely tell you that they're going to kill themselves. And it's often an impulsive act that happens, but it happens after these other signs have begun to brew for a while, usually.
It happens in the context of really having another condition such as depression that isn't treated or isn't fully treated.
And depression is probably the major one, and I think that with treatment with depression, you can definitely help to avoid suicidal ideas and suicidal ideation. So it's very important to get the treatment for depression. And depression can show itself in different ways in kids with the irritability, but often in adolescence it's extensive moodiness. And they can begin to become withdrawn, less involved, less interested in things. So you really need to look for those things. Now, if you treat the depression, yes, you can have good results, and kids can. Also, though, I think there needs to be a lot of work with schools to be aware of these issues, because kids' peer relationships are tremendously important with kids. And so I think schools and teachers and their peers need to be educated and understand the risks of depression, suicide, and how to get help. And there's been one really wonderful program that's is a model across the country called Sources of Strength, where individual teenagers in school are trained to be peer worker, to understand the issues of depression and other mental illness, and to actually hold sessions with kids and talk about it openly. I think an openness about it is what's really, really important in the schools and at home. Ask your kids. Sometimes people are afraid if you ask about suicide, you're going to think about suicide.
There's no connection.
The
evidence is that asking is actually protective. Not dangerous.
Yeah.
Not asking is what could be dangerous.
So if you're worried, say, how are you feeling? Have you ever thought about wanting to hurt yourself when you're feeling low like this? Ask kids. They welcome it. They may say no, but they've welcomed still being asked.
Bringing it up, just as you would bring up, you seem as if you're having shortness of breath, or that you're dizzy, or some other physical issue, bringing up depression, anxiety, thoughts of hurting oneself. Have the conversation.
Exactly, and they will welcome it. They will welcome it. And I think if you begin to think as a parent that there is something happening, then talk about it, and ask them what they'd like to do about it. And if you really talk to the kids, most often they will say they would like some help. So I think it's opening up the issue and helping them not to be ashamed about it, or helping them to understand it. Often when you talk to youth who've been through this, they don't understand what was happening to them. They truly don't. And they don't even know how to ask the right questions. So we as adults, as family members, as school teachers, we have to be able to kind of ask the questions, because they kind of don't know. Why do I suddenly feeling this way? I don't understand it. And often they will then retreat. So we need to ask, be open about it.
And I want to thank you for your good guidance to families, your leadership in New York State and across the country. And thank you for joining us here today.
Thank you so much for having me. Thank you.
As a parent and as a psychiatrist, I urge you to speak with your child's pediatrician or your own physician if you have concerns about your child. These professionals can help you help your child. Early interventions bring about the best results for our children. Do not try to go it alone. Seek help. With help, there is hope. Until next time, I'm Dr. Jeff Borenstein. Goodbye. Do not suffer in silence. With help, there is hope. Healthy Minds is brought to you in part by the American Psychiatric Association Foundation, the Graham Beck Foundation, and the New York State Office of Mental Health. If you would like to watch our expert interview in its entirety, log on to bbrfoundation.org/healthyminds.